Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to show you something that happens, and that's why anybody's teeth that look really good, how they get there, there's not too many people that allow them to get there. But I take a lot of joy in kind of directing things and letting nature do its thing. And most of the time it works out. Now, like the animals, there was a famous guy who worked in San Diego, and he was working on monkeys, and he closed the airway on a bunch of young monkeys, about like somebody who would be 10 or 12 or something like that. Sorry for the interruption, but anyway, these monkeys, he closed their airway, did the same thing for every monkey, in that these are rhesus monkeys. They're pretty close to human beings, you know, and all of them had a different reaction. None of them just fell in line, and every one of them did the same thing. They different things. And that's the way people are. People actually do the thing that would correct their teeth. Now, I've talked to you about people in Africa so much that people get tired of it, but I could not understand the people in that school in a town between Ibadan and Obobashaw. We had a church school, and there was probably a couple of hundred kids going to that school. And I went out there to do their orthodontics and their fillings, and I took the whole staff that I had in Ibadan with me, and they cleaned everybody's teeth, and I filled all the teeth in that school, and I did all the orthodontics. And there was not one person in that school that really needed orthodontics done. They grew up in the same type, and this village had been there for years and years. They married the same type of people. Everybody nursed for about 2.5 years, and they developed their airway. And there wasn't anybody in that school that needed orthodontic care. Nature took care of those people. I filled 12 cavities in the whole school. They never ate anything sweet. And that just, I don't have a picture of all that stuff, but that's what happened. And now, here comes a young lady that I'm going to show you as quick as I can what we did for her. And this young lady had a mild class 3 situation like that. Had her upper front teeth, the midline is off. Some of the baby teeth are still between the lower permanent teeth. And this is the way it had happened. Now, look at this model real close. The upper teeth are inside. Let me get that where I can mark again. I don't know what am I doing here. All right. Now, the upper teeth are meeting inside the lower teeth. sprouts. Same thing over on this side. Kind of like that young man, that 50-year-old man that I just got through. So this young lady comes in and we need to expand this. This is on young people. I hope you'll learn that you could do this. And there's some baby teeth left in here, stuff. Now watch what happens in here. We needed to torque these teeth out. So I'm gonna run real quick through something like that. It's pretty well class 1 relation back in here. This is biting inside. This was 1983. So here's the way that the cephalometric, you can see the upper teeth are inside, the lower teeth are outside. Now, we went in and did our tracing and everything else. She's age 12 and 6 months. About 12 and a half years old. So here we go. We have deciduous teeth. All these are deciduous teeth. And the cuspid's coming in here. Over on this side, the cuspid's coming down. And these are deciduous teeth. Now down on the bottom, this is permanent cuspid, deciduous teeth here. And she's got her 12-year molars coming in. You just look at what you've got and figure what you've got to do. Now there are missing lateral teeth in this particular girl. There's no lateral teeth between the cuspid and the centrals. All right, this is at the age 10 and 11, we started in to do this work. And the cuspid's coming down, he's the root of the way away from those deciduous teeth. Over on this side, it's not doing too good. But it's doing some. Down here, it's already in. All right, these cuspid teeth come into the mouth and they eat the baby teeth, roots off, and these teeth are coming out, and this permanent cuspid's coming down. No lateral teeth in the arch. So we come in here and we have a round wire in here, and we move that teeth out over that, and we expand it over this side and this side. And we brought the teeth out over the upper teeth. We brought them out over the lower arch. And this is the way it was. This is 1984. We did a palatal separator on the young lady. And we moved this. This is about how much it opened up. We moved those teeth out, crowned all of this stuff. We had this, and that moved the roots of the teeth with the crowns out there. Now there's no upper laterals in there. So here we come back with a kind of a reverse, I think they call this a Hickam chin cup. It pivots off of the chin right here, and we go back and catch the back teeth and pull them forward. You see the elastic is over there. And she covers this up, puts it over her head, it falls down on the head and pivots on the chin, and it slides the upper teeth forward. So we're going to fill in that gap where there's no laterals up there. And down on the bottom, we've got a baby tooth in between the two centrals, and I don't think there's any laterals there either. We were pulling that forward, and we got these teeth out here in this area, and they're kind of laying down in there. In other words, pushed them out this way. Now, we separated the palate, and this tissue was soft in here, and she started functioning properly. She was swallowing, pushing the tongue where it should be, and these teeth torqued themselves out. It's in this picture right here. Now let's go to the next picture. And there she is. This looks filled out good. It's a little short on that picture. We opened that space where the cuspid was, and we took artificial teeth and bonded on, and we put those on a retainer. Now it went on, and it's still not torqued. I had gone in with a rectangular wire to torque the teeth. Now, this is the same mouth, and we had moved those cuspids out. This tissue was soft where we had separated the palate, and the teeth were out like that at that time. They torqued themselves, they moved out, and then they brought the roots of the teeth out in that fashion. So there's the way they were when we went in, and then here's the way they torqued themselves out. I had nothing but a round arch wire on there, and that actually happened. Now we come in with a rectangular wire, and we put torque in it, and we put the artificial teeth in there. And these teeth are torqued along with this. It pushes the artificial teeth into the tissue, and you can't tell they're not real teeth. Well, if you look at the root carefully, you can. Now, that ended up torquing these teeth. She did the torquing herself, and the tissue was soft, and she correct function torques the teeth correct. There it is, 88. I ran into a dentist one time and knew this girl while we were straightening her teeth. And you see how she pushed this area up with her tongue. I did not have to torque it. And on the bottom, we'd have some space down there where she could have something done later on. She put some bridge work down in this part. And here she is as she gets a little older. You can tell there's a little bit of lack that's slipping out where it should be, but very pretty young lady. And she had a set of teeth like that. She wore a retainer with the teeth in, and if one of those teeth broke off, boy, she came and she would leave the office till we fixed it. And then she, when she got older, could have some bridge work done in that area. And there it is, still the artificial teeth there. And I always delighted in letting nature do part of the work in straightening the teeth. And we did. And so that's the end of this. I thank you for watching. But the reason we separated the palate and we had soft tissue there, and she started functioning correctly, using the tongue and the teeth that were inside, the lower teeth were outside. They spread out, and the proper use of that, the palatal separator, everything, did a good job lining this young lady's teeth up. Thank you for watching, and I'm going to say goodbye for this period of time. And I'll close out.